Okay, now we're going to take on two of the most controversial issues, death panels and abortion. And to help us with the death panel issue, we have a Gray Panther, Joan Davis. And what I want to ask you is it true that we want to pull the plug on grandma in health reform, that we're going to set up death panels that will tell people when they have to die, or that we're going to counsel people about euthanasia? Is that true?
I don't think so. And fact is, I'm very sure it is not true. I have been very much aware of the fact that people who don't want any changes at all are very eager to scare the living daylights out of anybody. They have a lot of experience, and they are very troublesome in that way, and it troubles me that we don't know how to convince them that they should stop doing that sort of stuff. Where I grew up in the Bronx, the language would describe what they're doing very colorfully, but I'm a lady, so I will just let it go at that. I prefer a single-payer plan, and I resent the idea that older people are only interested in their own health care. It happens not to be true, because everyone should be able to see a doctor when it's necessary. And it is a shame that when people are sick, they have to worry about their finances. Everyone should be able to have the care they need. About this misconception that older people will be thrown into the fire by the proposed plan for the health care is pure bunk, or impure bunk, however you want to describe it. Many years ago, my doctor asked me, in case I was in a position where I could not speak for myself, what kind of life-sustaining measures would I want? So I spoke to my friends, and I went to find out what they're doing, and I spoke to a few other people, and a few other people, and what are you doing for yourselves? You know, this was a subject. This helped me clarify my thoughts, and I filled out a healthcare proxy. That's not euthanasia, not by any stretch of the imagination. And lo and behold, I began to feel better. I had clarified my thoughts, a very unpleasant topic. You know, nobody likes to see themselves, picture themselves as in a hospital, inert, and with machines just doing everything that your body should be doing and has been doing for years. So my thoughts were now on paper, and I felt better. And I also felt that my relatives would be relieved, because they wouldn't have to figure out what was best for me, because I had given it thought. And that's what I feel is true about that situation. I have lots to say about the rising costs of that other misconception. Might I, or should I just?
Can we wait until a little
bit later?
We'll wait.
Okay, I'll sneak it in later. But I want to say that the insurance companies are heavy-handed in promulgating this idea that grandma is at death's door and we're just going to shove her into a pit. And I think they should be highly ashamed of themselves.
All right. Good job. I knew if we got a Gray Panther, we'd get the right answer. And just a little bit, we'll take questions. But first, I want to ask Alice Berger to take on this issue about public funding of abortions. And I should preface it by saying that I come from the reproductive justice movement. And if it were up to me, I would have public funding of abortions for poor women, because it's discriminatory against poor women and denies them access to basic primary care. That said, I want to ask Alice, does the health reform legislation now pending before Congress allow public funding for abortion?
Well, Lois actually stole my introductory comment because it's a very bizarre position to be debunking the myths, but the debunking that you're doing is something that you don't believe in. So, but having said that, I will answer the question and be clear about it. The first thing I want to say, and I know it probably represents a lot of what's felt in this room and certainly beyond this room, is that we very strongly believe that abortion is part of comprehensive preventive care for women. So that's the premise that we start with. Thank you. Having said that, as really mirroring what some of my colleagues here have said, is that what is being proposed is a continuation of the status quo. What is being proposed in the current health plans right now is a continuation of what some of you might have heard of, which is the Hyde Amendment. The Hyde Amendment was passed in 1976, and basically what it says, and has continued to say, mirroring Lois unfortunately, is that no federal dollars can be used to pay for any abortions for women that are covered under Medicaid unless except for conditions of rape, incest, and if the woman's life is in danger. So right now we have a situation where no tax dollars can go from the federal government to pay for abortion. That will continue under the plans that are being proposed, the different bills that are out there right now. Now, having said that, we do always have the option, and we are fortunate enough to live in New York State, where that option has actually been in place since the 1970s, right prior to Roe v. Wade, where states can decide to use their own dollars and make sure that women who in fact are covered on Medicaid can obtain abortions. And that's what we do have in New York State. But again, to reiterate, tax dollars will not go under what's being proposed to pay for abortions. I should also say that currently right now, as sort of a continuation, and another two groups under the Hyde Amendment, is that women in the military cannot get what is referred to as elective abortions, nor any of the women that are either the spouses of any of our congressmen or any federal employees, or women who are federal employees also cannot have their abortions paid for, because those are dollars coming from the federal government. So the answer is absolutely not, and just wanted to say also, because it's sort of part and parcel of the same myth, which is that because abortion is so highly politicized, it is really the only benefit that has actually risen to this level of discussion to actually talk about that it should or should not be included as a benefit. You don't hear that about anything else. You certainly don't hear that about that a dermatologist should not cover X, that there shouldn't be a CAT scan done for whatever. It's the only medical procedure that, again, has come to the forefront. So it's completely inconsistent with any of the other discussion that's taking place. The other thing to add is that about 86 or 87% of all private plans do cover abortion right now. So it's not that this is introducing a sort of apples and oranges. It is, again, that we live, again, under a medical system that if you are fortunate enough to, again, have private insurance, the chances are, certainly not 100%, but 86 or 87%, you're going to have your abortions covered. But again, if you are a low-income woman, you're covered under Medicaid, and you don't live in a state that has put in state-only dollars, your abortion will not be covered. So the answer is no tax dollars, status quo.
Okay, we may not like the answer, but there it is. Thank you, Alice.